Glasgow City Council, British Sign Language, BSL, Local Draft. Number 1. Across all services. We share the long-term goal for all Scottish public services set out in the BSL National Plan, which is, across the Scottish public sector, information and services will be accessible to BSL users. Our actions by 2024. We will establish an ongoing reference group of BSL users to continue to develop actions over the duration of the plan, and to address any emerging issues with regard to service delivery. Develop a report on the number of BSL users known to Glasgow Council family. In particular, those using social work services. Improve access to our information and services for BSL users, including making our website more accessible to BSL users. This will include considering BSL-friendly options as part of the development of our new corporate communications strategy. Improving availability of information about available services through BSL videos. Exploring training opportunities for communication staff on how BSL is structured, to consider when writing website materials and leaflets. Looking to expand the number of Glasgow Life venues which have BSL welcome videos. Continuing to roll out BSL video content to Your Support Your Way website, which provides information about a wide range of health and social care services available within Glasgow. Updating Centre for Sensory Impairment website to ensure interpreting service information is up to date. Promoting the use of the Scottish Government's nationally funded BSL online interpreting video relay services called Contact Scotland BSL to staff and to local BSL users. This will be done through referencing on our Contact Us section of the website and through training of call centre staff. Signpost staff who work with BSL users to appropriate the BSL and deaf awareness training. In terms of general access to our services across the Council family, we will formally review the BSL interpreting service, continue to roll out e-learning sensory awareness programme, which is currently being used across health and social care platforms, and measure uptake. Further develop formal classroom training, which will be implemented across social care services, including residential and daycare services. Undertake a skills audit of staff to determine who can use BSL and who would like to learn it. Consider incorporating BSL spell your name signage for children and accompanying adults as part of play park refurbishments. Continue to provide BSL sessions as part of Adult Learning Week in Glasgow Life. Number 2. Family support, early learning and childcare. We share the long-term goal for all Scottish public services set out in the BSL National Plan. which is the Getting It Right for Every Child approach will be fully embedded with a deaf or deaf-blind child and their family offered the right information and support at the right time to engage with BSL. Our actions by 2024. We will provide early years staff with information about BSL and deaf culture, and about resources that are available in BSL, so that they can meet the needs of families with a deaf or deaf-blind child. Continue to work with speech and language therapists from NHS to assist with care plans for children. Review e-learning programs available to education staff. Review referral pathways for children entering and leaving education services. Improve links and communication with partners to continue to signpost families to appropriate agencies for sign language support through our early years multidisciplinary clinic and the early years new referral clinics. Explore further opportunities for sign language training for all staff that support deaf learners. Continue to work with nurseries, primary schools and secondary schools where appropriate to facilitate and train staff in Makaton where it is used as an inclusion tool. Number 3. School education. We share the long-term goal for school education set out in the BSL National Plan, which is children and young people who use BSL will get the support they need at all stages of their learning, so they can reach their full potential. Parents who use BSL will have the same opportunities as other parents to be fully involved in their child's education, and more pupils will be able to learn BSL at school. Our actions by 2024. We will contribute to the Scottish Government's investigation of the level of BSL held by teachers and staff working with deaf and deaf-blind pupils in schools, and take account of any new guidance for teachers or support staff working with pupils who use BSL. Continue to offer BSL classes to teachers in primary and secondary. Maintain and continue to develop skills in the specialist sector. Work with the Scottish Qualifications Authority, SQA, to develop an initial suite of awards in BSL, which will form the basis of any future development of BSL qualifications, up to Level 6 of the Scottish Credit and Qualifications Network, and identify potential for teachers to provide BSL learning in schools. Undertake an education staff survey to identify BSL users who are in school but not currently utilising their BSL skills. Take forward advice developed by Education Scotland to improve the way that teachers engage effectively with parents who use BSL, and ensure that parents who use BSL know how they can get further involved in their child's education. Continue to provide information and guidance for all schools. Ensure deaf parents have access to information in BSL. This includes report cards, parents' evenings, routine information, and being able to participate in parent councils. Be proactive through St. Roch's learning community in seeking views of parents and third sector who use BSL with regards to parent involvement in education. Contribute to the Scotland's National Centre for Languages, SCILT, programme of work to support the learning of BSL in schools for hearing pupils as part of the 1+2 programme, including sharing best practice and guidance. Pilot the new SQA units for BSL in mainstream secondary. Continue to investigate and support with St. Roch's learning community in collaboration with schools. Opportunities for learning BSL in schools. Ensure that all staff and young people will have the opportunity to learn BSL, leading up to national qualification within the St. Roch's learning community. Number 4. Training, work and social security. We share the long-term goal for training, work and social security set out in the BSL National Plan, which is: BSL users will be supported to develop the skills they need to become valued members of the Scottish workforce, so that they can fulfil their potential and improve Scotland's economic performance. They will be provided with support to enable them to progress in their chosen career. Our actions by 2024: we will signpost pupils and students to a wide range of information, advice and guidance in BSL about their career and learning choices and the transition process. Work with partners who deliver employment services and with employer groups already supporting employability to help signpost them to specific advice on the needs of BSL users. Raise awareness of our employment support services with BSL users. Continuing to promote Glasgow Guarantee vacancies through Remploy. Continuing to support the Open Door Employability Project, which provides waged work experience. Support and training to disabled people who wish to enter employment, education, or volunteering. Continue to actively target BSL users through this project. Continue to work through the Centre of Sensory Impairment with both deaf and deaf-blind young people by carrying out route work. Independent living skills and mobility training. Provide a 5-day duty service through the Centre for Sensory Impairment that provides information to deaf individuals of all ages on support services, employment and benefits. Raise awareness locally of the UK Government's Access to Work (ATW) scheme, with employers and with BSL users, including those on modern apprenticeships, so that they can benefit from the support it provides. Scope opportunities to capture modern apprenticeship BSL requirements on the MAPPIT database as part of the scheduled upgrading. Number 5. Health, including social care, mental health, and well-being. We share the long-term goal for health, mental health, and well-being set out in the BSL National Plan, which is: BSL users have access to the information and services they need to live active, healthy lives and to make informed choices at every stage of their lives. Our actions by 2024. We will signpost BSL users to health and social care information available in BSL. To be produced by NHS Health Scotland and NHS 24. And develop complementary information in BSL about local provision as appropriate. Undertake a self-evaluation to allow social work services managers to consider a range of accessibility issues. Including awareness amongst staff of how to signpost to relevant information available in BSL. We will then build on findings of self-evaluation. Scope the provision of formal certified BSL training for appropriate frontline HSCP staff. Scope where deaf awareness training would be most appropriate and most effective. Ensure opportunities presented through improved use of technology are acted upon. Explore the use of phone scannable codes, QR codes, to access virtual information concerning deaf organisations and deaf clubs for BSL service users. Continue to work with care homes to highlight and record sensory loss and communication needs in clients' records when they enter into care homes. Review existing deaf access to self-directed support, SDS, and map the care pathway currently available to BSL users and develop an action plan. Continue to develop BSL information on the Your Support Your Way Glasgow website, including information on deaf organisations and clubs, health and social care supports, and sport and leisure opportunities. Include a short welcoming film in BSL on the homepage of the Your Support Your Way Glasgow website. Scope options for pre-flagging BSL users on client records. In order to facilitate appropriate translation or interpreting services, in advance of specific appointments and general engagement. Complete the formal review of the BSL interpreting services and report on the recommendations by end March 2019. We will work closely with NHS GCC through Glasgow's Integrated Joint Board, IJB, to ensure that psychological therapies can be offered on a fair and equal basis to BSL users. Launch a suite of films, Positive Signs, in September 2018. On positive mental health promotion and resilience messages. Review access routes to psychological therapies, including how BSL users can access at a local level and on a fair and equal basis. Take steps to improve access to information about sport and to local sports facilities and sporting opportunities. Continue to support deaf children to attend swimming lessons by ensuring that swim coaches are appropriately trained to offer deaf-friendly swimming. Consider options for having BSL signing available at Glasgow Life operated sporting events. Continue to support interactive participation on walking groups through use of visual and tactile materials for individuals, groups, and their interpreters. Continue to support countryside ranger talks for West of Scotland Deaf Children's Society. Ensure that any local work to tackle social isolation explicitly considers the needs of BSL users. Using direct links established with the Campaign to End Loneliness, there will be a specific focus on tackling isolation for older BSL users. Number 6. Transport. We share the long-term goal for transport set out in the BSL National Plan, which is BSL users will have safe, fair, and inclusive access to public transport and the systems that support all transport use in Scotland. Our actions by 2024. We will action to support safe, fair, and inclusive access to public transport. We will develop as part of the Connected Transport Strategy for Glasgow by the Glasgow Community Planning Partnership. Specific actions will be developed to support BSL users. Number 7. Culture and the arts. We share the long-term goal for culture and the arts set out by the BSL National Plan, which is BSL users will have full access to the cultural life of Scotland, an equal opportunity to enjoy and contribute to culture and the arts, and are encouraged to share BSL and deaf culture with the people of Scotland. Our actions by 2024. We will enable BSL users to take part in culture and the arts as participants, audience members, and professionals by improving access to the historical environment, cultural events and performing arts and films for BSL users. Continue to offer interpreted museum objects through a deaf lens. Continue to support deaf volunteers to deliver monthly BSL tours of museum venues. Roll out interpreted tours to the Mitchell Library. Continue to support interpreted events as part of festival performances. Signpost BSL users, particularly young people, to get the most from cultural opportunities by building relationships with organisations such as Solar Bear. Support deaf artists to be a fully inclusive part of performances. As part of the Burrell Collection redevelopment, investigate making use of technology, such as Signly, to ensure displays are accessible. Work in collaboration with BSL users to create a display at the redeveloped Burrell Collection. Encourage and support BSL users to consider a career in culture and the arts. Promote both voluntary and professional arts opportunities to BSL users. Promote future careers in culture and arts by working closely with partners, such as Solar Bear, Deaf Youth Theatre, and the Royal Conservatoire. Work with the Royal Conservative BSL Acting MA for future programming at the Burrell Collection. Continue to support volunteer guides by offering opportunities for volunteering and training. Increase information in BSL about culture and the arts on relevant websites and at venues. Look to expand the number of Glasgow Life venues which have BSL welcome videos. Number 8. Justice. We share the long-term goal for justice set out in the BSL National Plan, which is BSL users will have fair and equal access to civil, criminal and juvenile justice systems in Scotland. Our actions by 2024. We will, as part of a review of community justice, consider how we can implement the BSL recommendations from the Criminal Justice Disability Project, which includes better inform solicitors that funding can be sought for special arrangements needed by clients. E.g., BSL interpreter, or to visit a client at home. All correspondence should be in plain English. Improve staff awareness of the needs of deaf people and how to respond to BSL translation requests. Number 9. Democracy. We share the long-term goal for democracy set out by the BSL National Plan, which is BSL users will be fully involved in democratic and public life in Scotland as active and informed citizens, as voters, as elected politicians, and as board members of public bodies. Our actions by 2024. We will consider how the Access to Elected Office Fund could be used to promote involvement of BSL users in community councils. Take opportunities to promote the Access to Elected Office Fund locally, which can meet the additional costs of BSL users wishing to stand for selection or election in local or Scottish Parliament elections. We will highlight the fund in all local government and Scottish Parliament by-elections. Include details of the fund in all our nomination packs and discussions with any potential candidates. Be more proactive in readying elected office support provided to support BSL users. As part of a digital review, consider the information that should be available online in BSL for potential elected members. With the improvement service, consider the advice, training and guidance available for elected members. Scope options for providing a BSL signed version of full council on our website. Aim to increase participation on Community Council Discussion Forum by promoting the availability of translators for these events. Develop an information video for BSL users on how to engage in council family consultations for our consultation hub. Include BSL as a key consideration in our revised consultation guidance.